when do you know, or like when can someone figure out like when they should seek out medical intervention? Because obviously there's a lot of different medical interventions, whether that's like a medical diet plan. Obviously there's medications that you can take, there's surgery, and there's a progression. But like when does somebody know when they need to start taking or thinking about taking medications for weight loss?
Well, there are guidelines. The American Endocrinology Association did come up with guidelines as far as that. And that's where BMI is helpful. If you are in the obese range as far as BMI, or you have a BMI of 27 and higher, along with a chronic disease that is associated with obesity.
Some chronic diseases associated with obesity. What would some of those be?
High blood pressure and diabetes are your biggest
ones. The big ones. Okay.
Yeah. So if you would have one of those conditions and you have a BMI of 27, you qualify also. So that's kind of the guidelines that most doctors use is 27 plus a medical condition. I think 30 is the cutoff for obesity. So 30 and higher without a medical condition means you're a candidate for it. Now, most doctors will ask if you've tried diet and exercise first. And you know, that's the standard because, you know, they have to show that the risk, the problem with medications is there is no medication out there that doesn't have risk.
Right.
And you have to weigh the risk versus benefit ratio. And so if you've got somebody who has a body mass index of 27 or higher and has high blood pressure as a result of carrying that extra body fat, or you have someone with a body mass index of 30 or higher, without that, their risk is high because of having obesity, of having that disease, you know, and therefore the benefits of using medication is pretty good because the risks are high. If you have someone who's 27 BMI and has never tried diet and exercise, it might be harder to justify the risk of using medications for someone who hasn't tried a more benign treatment mechanism. But there's a huge number of people out there where the risk of medications for obesity, you know, semaglutide is one that comes to mind. The risk of that particular medication is lower than the risk that they are getting from having obesity as a chronic disease. But I think the other important thing that we need to point out too, that has become more and more recognized over the last 5 years or so, is that because obesity is a chronic disease, we can't expect that we're going to give somebody a prescription for 3 months of a medication. They're going to lose 20 pounds and there you go. Goodbye. You're done. Because that's not it. You know, obesity is a chronic disease, just like high blood pressure is a chronic disease. It needs long-term management. And the clinical trials that, you know, there's been, I think, 8 clinical trials on semaglutide right now, the main 4 ones, and then some others. But the average weight loss was 35 pounds, which is a significant benefit. Think about what that's doing to your heart, your joints, your blood sugar, your blood vessels, everything. So certainly very good. But what happened when people stopped taking the semaglutide? You know, they started having a gradual regain of their weight. And that's why we really need to understand that just like when you get somebody's blood pressure under control, you don't just discontinue their blood pressure medicine. When you get somebody's body weight under control, and you don't just discontinue their medication.
So I have 2 thoughts with that. One is I think I remember seeing a video of someone explaining exactly that same point that you just outlined there. But they were saying that what they did in a post study is that they kept them on a low dose of semaglutide, not the same maintenance dose that they're doing, but they put them on a low dose, and they're essentially able to maintain that. And that's one way to go about it if you're willing to stay on medication. But really, I think at the heart of all this, using medical intervention is essentially, we should really just view it as a tool to change behavior. Would you agree with that?
Well, that's the ideal.
Yeah.
And if you can do that, that's perfect. So if you can get somebody to choose a better diet and exercise more while they're on the semaglutide and losing weight, and then continue that behavior afterwards, then
that's the ideal.
That's even better. Yes.